Hi everybody, my name's Dr. Jonathan Kuttner. Chronic pain syndrome. Now these are three very descriptive words, and a chronic pain syndrome is something that tens to hundreds of millions of people suffer from all around the world. So very, very common. Chronic means something that has lasted for 3 months or longer. And for most people, it's a lot longer than those 3 months. Pain, well, that's an inner sensation. It's an inner perception or experience, which everybody in the world has and is quite difficult to describe, but we know what pain is. Syndrome, well, now this is an interesting word because it means a collection of symptoms. So when a doctor says to you, you have a chronic pain syndrome, that means you have pain, but also you've got other things. You may have fatigue, you may have depression or anxiety. It may affect other parts of your body, so you get palpitations. It may affect your gut and you have irritable bowel syndrome. It may affect your periods if you're a woman, and so on and so on. So there are all these other symptoms that get bundled in to chronic pain syndromes. Now, the actual underlying cause of chronic pain syndrome is this. The fundamental cause of the pain that you continue to suffer is a result of the fact that your pain system has stopped working properly. So for the majority of people, you may have sprained a wrist or had a minor injury, and that minor injury should have got better, but it didn't. And what happens is that the system, which is the nerve endings, the nerves, up to the spinal cord, all the way up to your brain, that's your pain system. That system, which should just pick up the message and relay it absolutely accurately to your mind, that system has started to malfunction. And the way it malfunctions is that on the way, the message gets picked up, and as it comes to your spinal cord, the initial nerve stops. It now has to talk to another nerve. And when one nerve talks to another nerve, at that point, there's the potential, because there are little receptors, for the message to become amplified and distorted. And this is what happens in a pain syndrome. The message starts off as, oh, now my wrist is all better, it's healed. It hits the spinal cord, the amplifier is stuck on. And now the message that continues up to your brain, which is not the correct message, but this is what your system does. The message is that now my wrist is still in terrible pain. That's what you feel, and therefore that's the message that arrives in your brain. That's what you perceive, and therefore you continue long after your wrist has got better to feel this terrible pain from your wrist. That pain may affect half of your body, may affect your whole body. It's a very, very complex problem, and once you're living with this awful pain, then all the other complex symptoms that I described before start occurring, because pain now is not just a symptom, pain now is a disease. Thank you.